Good afternoon. I'm here with Professor Bax from Europe. Jeroen, this is the 15th year of the Echo Horizons conference, and most of those years you've been here. Of course, we had an interruption with the COVID, but as a busy clinician and a very industrious researcher, we appreciate your commitment to Echo Horizons, and I'm sure the South African audience appreciates you as well. Can you give us some insights regarding your commitment to education?
Thanks. First of all, it's a pleasure to be here. It's really one of the better meetings that I have been to. This is full of really practical education for the practicing clinician. And I think that's what people are looking for. They are looking for, in my clinics, I get confronted with this and this and this and this, and this course here actually focuses on all these clinical perspectives. And I think that's very important. For myself, I'm also a practicing clinician, so I am specialized in some things, but not in everything, of course. So I'm learning myself here and taking the advantage to listen to the things what I'm not specialized in. I think it's a superb course put together with really good speakers and a nice audience. They really enjoy it, and so do I.
Well, thank you for that. I was very intrigued by your discussion, and in fact the entire session, on the evolution of the management of aortic stenosis. I was particularly intrigued by your presentation on the management of moderate aortic valve stenosis. Can you provide us with more insights as to your thought processes and how you arrived at this juncture with regard to the management of moderate aortic valve stenosis?
Yeah, thanks for that question. I think we got to this idea to work on moderate aortic stenosis because we looked in our big echo databases and we saw that patients with moderate aortic stenosis actually had a much higher event rate or survival, much lower survival rate than was anticipated based on their risks for coronary disease, etc. And so we then went to look further in other databases and brought all these data together, and we looked at specifically what is the outcome of a patient with moderate aortic stenosis, and the mortality was really quite significant. And the interesting thing is that we then went to look at all the different factors that could relate to that, so we got an idea what are the specific patients that we're looking for. In general, what we learned is moderate aortic stenosis is not benign. It is associated with the worst outcome, and that was first presented in this huge database from Australia, and then we did it in our database. And I think what happened is that this was picked up by companies who work in the heart valve industry, and both Medtronic and Edwards Life Science both invested in a randomized controlled trial looking at patients with moderate aortic stenosis to either treat them conservatively or give them a transcatheter aortic valve replacement. And those trials are up and running now, and we will see in the future what's going to come.
Sounds like an exciting prospect and reminds me of mitral regurgitation due to degenerative mitral valve disease. Yesteryear, decades ago, we would surgically manage patients with mitral valve regurgitation if the LV was already damaged, patient had atrial fibrillation, congestive heart failure,
Right.
And New York Heart 3 to 4 symptoms. Of course, that paradigm has shifted to the point that in good valve repair centers, asymptomatic patients with severe MR with a good likelihood of valve repairability undergoing the procedure now safely with near zero morbidity, mortality.
Absolutely.
Sounds like that's the direction the management of aortic stenosis is going into.
I think so, and I think if it shows that benefit, we're doing something very good for our patients, because we identify the patients at risk according to echocardiographic information, etc. We can treat them, and if that prolongs significantly outcomes, yeah, that would be fantastic.
Have you looked at the option or the possibility that the valvular degeneration in aortic stenosis may be a marker of overall cardiovascular unhealth?
That's an interesting idea. Yeah, it could be a marker of, let's say, high cholesterol, etc. It is associated with higher cholesterol levels. So, yeah, these things are probably, we're going to learn a lot about it by doing these trials and seeing these patients and bringing the data that we're going to have together and see what it was going to tell us.
Well, Professor Bax, we look forward to more on this topic in future years, and on behalf of the conference organizers, as well as the audience who are made up of cardiologists, anesthetists, and fellows in training, for your contributions, as well as the other international speakers. We look forward to you providing valuable insights into imaging, echocardiography, and of course this novel topic. Thank you very much.
Thank you so much. Thank you.